Colorectal cancer is the fourth most common cancer among men and women in the United States.
Newswatch 16's Justin Gick break down the most common conditions colon and rectal surgeons see in tonight's Healthwatch 16 report.
Healthwatch 16 is sponsored by UPMC, life-changing medicine.
When it comes to conditions in the colon and rectum, surgeons who specialize in these specific areas see a lot. Dr. Amy Curry is a general surgeon specializing in the colon and rectum at UPMC in Williamsport. She says she sees all kinds of different conditions when it comes to these two areas.
From the colon standpoint, we'll see things like colon cancer, diverticulitis, inflammatory bowel disease like ulcerative colitis or Crohn's. From the anal rectal standpoint, we also treat things like anal cancer, hemorrhoids, anal fistulas, anal fissures, and even fecal incontinence.
Dr. Curry says one of the most serious conditions she and others treat is colon and rectal cancer. She says typically with colon and rectal cancer, if you find it early enough, the treatment is surgical removal of that piece of the colon or the rectum where the cancer is. Dr. Curry says they then try to put the colon and rectum back together so they restore continuity of the bowel.
Other, maybe less serious diseases like anal rectal conditions like fissures or fistulas or hemorrhoids, we can try and treat medically up front. And if things are refractory to medications, then there are surgeries or even sometimes in-office-based procedures that are easier that we can do for those types of conditions.
As far as what screenings are recommended, Dr. Curry says they have somewhat recently changed for colon and rectal cancer specifically. She says screening is recommended at the age of 45, and that's to screen and try to find and treat precancer conditions of the colon before they would be able to turn into cancer.
The screening has now upped in age to age 45 now because we are finding that it has breached over 10% of colon cancers are now diagnosed before the age of 50. So it's now, even more important to try to get your screenings on time.
Dr. Curry says there are other non-invasive ways aside from a colonoscopy to test for colon cancer. She says they include a Cologuard or even fecal occult blood testing that you can do that doesn't necessarily involve a procedure. Dr. Curry says to talk to your doctor about those tests as they are for more low-risk people. She says if you do have family history of polyps or colon cancer, then the only screening that is recommended is colonoscopy. If you're a low-risk person and have a normal colonoscopy, Dr. Curry says typically it's 10 years until your next one.
Unfortunately for colon cancer, one of the main risk factors is your genetics and your DNA. So, family history plays a big role in your risk factors.
Dr. Curry says to reduce your risk, maintain a high-fiber diet, reduce the number of processed foods and red meats, exercise, and not smoking or excessive drinking. For this Healthwatch 16 report, I'm Justin Gick, Newswatch 16.